Welcome to MyCare channel. First, a catch up with the latest COVID numbers. The World Health Organisation's COVID-19 dashboard shows that since the start of the pandemic, there have now been around 250 million reported cases of the disease globally, with more than 5 million deaths. The US remains the worst affected country, recording over 46 million cases, followed by India at more than 34 million and Brazil at close to 22 million reported cases. For Australia, according to the Health Department, we've seen 181,000 confirmed cases with 1,827 deaths. As Australia marks Cervical Cancer Awareness Week, the federal government has announced that women will soon have the choice of doing their cervical screening test themselves, rather than going to the doctor. The announcement is a game changer for many women, especially in Australia's Indigenous and migrant communities, who often find the test with a doctor too invasive. The self-test is taken using a simple swab and is just as effective as a test in a clinic. Close to 1,000 women are diagnosed with cervical cancer each year, but the chance of surviving is now close to 75%. And Australia's Chief Medical Officer has urged Australians to start participating in life again as COVID-19 restrictions are lifted. Professor Paul Kelly said with 80% of Australians now double vaccinated, now is the time to be confident and get back into social activities. Although COVID-19 is in the community, he says the number of people to become seriously ill will now be relatively small. He reminded people to keep up good hand washing and hygiene and stay home if you're unwell. And he added that COVID treatments in the form of pills that can be taken at home will likely be available in the new year, subject to TGA approval. These treatments that are already available in hospitals will help to reduce the potentially serious effects of COVID-19. For those who are feeling anxious about the return to normal routines, Professor Kelly's advice was to talk to friends and family, reach out for mental health support if you need it, and stay connected.
Coming up later in the program.
For all of those in our audience who maybe don't know about the Multicultural Centre for Women's Health, can you tell us a bit about your organisation and the work you do?
Multicultural Centre for Women's Health is a migrant and refugee women's health organisation. We've actually been going for 43 years, so I hope some of your listeners have heard of us over those years.
Namaste.
안녕하세요.
Ni hao.
Salam.
Ahlan.
Hola.
Namaste, Manima Lama.
저희는 MyCare 채널입니다.
We are a not-for-profit community organization.
في تقديم المعلومات مجانية فيما يتعلق بالرعاية الصحية والخدمات الاجتماعية.
Somos time experiente em trabalho social e estamos aqui para ajudar.
ما از مددکاران اجتماعی در اینجا برای کمک به شهروندان استرالیایی، افراد مسن و افرادی که معلول هستند.
सूचना, सल्लाह र बाटो निशुल्क उपलब्ध गराएर उनीहरूको आवश्यकता पूरा गर्न र उनीहरूको लक्ष्य प्राप्त गर्न सहयोग गर्न यहाँ आएको छ.
As a social workers here at MyCare channel, our aim is to connect you
with the right home care, aged care or NDIS services.
And providers, we understand that
finding the right support can be difficult and confusing. So we're here to guide you through the process.
我们在这边用26个不同的语言来帮助你。
To keep up to date with the latest healthcare news, or to access free support from our social workers, subscribe to our channel and mailing list, follow us on our socials, or call us on 1300 46 1300.
If you know or are a young person living with neurodiverse conditions, you'll want to meet Hayden Payne, public speaker, trainer and founder of Spectrumite. It's a mentorship and training provider aimed at arming individuals with practical skills to conquer the challenges that stand between them and success in social interaction, education and employment.
Well, my business Spectrumite started with a core idea. What would I, as a 30-year-old man that has lived with a bunch of different disabilities and neurodiverse conditions, go back in time and teach my 16-year-old self? What potholes would I tell that awkward, self-doubting teen to avoid? What lessons would I impart? What would I teach him? And I was offered an opportunity to speak at the Luke Predis Foundation and was talent scouted there by SSI, and one thing has led to another, and I now have an amazing team of individuals supporting me that have helped me build my business into a peer mentoring and service provision model with a difference.
What encouragement can you give to those with neurodiverse conditions?
You have always felt alone. You have always felt isolated. You've never truly felt as if you've belonged. You might feel like an alien walking around in human skin, in a body that doesn't fit and a brain that doesn't work the way it should. There are others out there with the same lived experience as you. We are few, but we exist. It's always been my goal to unite us disparate members of a lost tribe, to bring us together and show us we are not alone. We have friends. We have the capacity to succeed. We can help each other. We can build peer bonds and friendships and a community in which we have a place. Once we have that, we can reach out into the external world. And if you don't think there is a niche that is available for you, a job that suits you, a place where you can be employable or give something back or find an exploitable skill that you can use to meet your needs, get a partner, have a family, live independently. If the niche doesn't exist for you, if there is no slot for you to fill, get a proverbial hammer and chisel, find the nearest blank spot on the wall and carve it out. And you might think you can't do that. I grew up my whole life bullied from primary school onwards, physically, emotionally, verbally, beaten every day simply because I was a nerd and a skinny kid and a year behind in physical development because I was born late in the year. I am one rake away from a black belt. I learned how to defend myself, how to evaluate my environment, how to build and develop strategies to function independently, how to look at something as simple as a shopping trip that once caused me immeasurable harm, immeasurable stress and worry, and go, how am I going to get in here, out of here, get what I need, advocate for my needs, and get what I need to get done, and still be able to complete the rest of the tasks that I have to accomplish this day. I have established a business with support, with people helping me in the areas where I do not have talent, and I am focused on the areas where I do have strengths. You can't do it all alone. But with me, the other facilitators on which I'm growing this business to provide, and the Spectrumite tribe and crew, you can.
Hayden, what would you tell your 16-year-old self?
You are more than what you could be. Those who critique you, who ridicule you, who accuse you, have their own problems, their own reasons for engaging in that kind of conduct, and they are on their own journey. They have their own flaws. And the reason why they act in these terrible ways is because they do not know better. Treat yourself well. Give yourself time to recover. Understand that the world is not built for you, but you still have to live in it. The cards that you were dealt are not the best hand. That means you have to get better at working with that hand. Build a support network around you. Get people on your team that can do the things for you that you can't. And where you have incredible strengths and marketable skills and unrivaled abilities, sell those, maximize those, and make those available to the world so that you can give something to it that you can be proud of.
There are things we can do and things we can't. Sometimes we need just a little bit of help, and sometimes quite a lot. Whatever your need as a person living with a disability, MyCare channel can put you in touch with the people who can assist. You don't need to navigate the process alone. Just call us on 1300 461 300 or visit mycarechannel.org.au and we'll start you on the journey of a life lived to the best of your ability.
Research shows that in Australia, women of migrant and refugee backgrounds are at higher risk for poor mental, physical, reproductive and sexual health. One organisation on a mission to change this is the Multicultural Centre for Women's Health. Executive Director Adele Modolo joins us today. Adele, thank you so much for joining us.
My pleasure to be here.
For all of those in our audience who maybe don't know about the Multicultural Centre for Women's Health, can you tell us a bit about your organisation and the work you do?
Sure. Multicultural Centre for Women's Health is a migrant and refugee women's health organisation. We've actually been going for 43 years, so I hope some of your listeners have heard of us over those years. And we are run by and for migrant and refugee women, so all of our staff are from migrant communities. And we do a whole range of different things, but all with the aim of promoting migrant and refugee women's health and wellbeing. So we conduct sessions in languages about health issues. So whatever the main kind of women's health topics are, we'll train up our health educators, and then they go out into the field, into women's workplaces or where they're learning English, or it might be in a mums group or other kinds of social groups, ethno-specific social groups, and we'll provide a whole series of health education sessions to women in their language.
And you mentioned then you've been operating, well, the centre's been operating for 43 years now. Can you take us back to when you started or when the organisation was first opened in 1978 and what it must have looked like? Because I'm assuming it was founded by migrant and refugee women. How difficult would it have been for them to start an organisation like this back then?
Absolutely. It was actually very much a coalition organisation. So it was people who were in the union movement, it was migrant women activists themselves, it was non-migrant women feminist activists as well, who all came together around the issue of abortion and contraception, actually, because at the time there had been some research done that found that migrant women had a higher rate of termination than non-migrant women, and that the way that we needed to address that was through training up peer educators to be able to provide them with information about their contraceptive options. So it was really looking at an upstream approach. So, what is it that's causing, migrant women not to have as much choice over their reproductive health, spacing their children, or, whether they were wanting to have children or not. And so we were able to provide in-language information about contraception. And at that time, we mostly visited women in factories because that's where so many migrant women worked. By the time I got involved with the organisation, there were 12 languages. And they were still visiting, so that was back in 1994. That tells you how long I've been involved. They were still visiting quite regularly a whole range of different types of factories, and there were still quite a lot of migrant women involved. And of course, that has changed over time. There are lots of different workplaces now. Our manufacturing industry has really decreased over those years. And so now we visit migrant women in lots of different other settings where they're working or doing other things like learning or socialising.
I wanted to ask you a little bit more about the programs that you are running, because obviously it's so important that women get the information, particularly migrant women and refugee women, in their native languages. And that's something that your organisation and MyCare channel share in common. We are catering for cold communities by providing info in their native language. Why is that so important, and how do you deliver those programs in their languages?
Look, it is so important that migrant women have the information they need in their language. And it really is, in some ways, not regardless of proficiency in English. Of course, proficiency in English makes a big difference. But you might have a woman who is comfortable with English conversationally, but when it comes to really understanding and processing complex women's health information, it's really important that that is in their language. So I think that just in terms of information being accessible, understandable, something that is meaningful, because, you know, you might have learnt a whole lot of kind of terminology in your language about women's health or about, you know, biological functions even in your language. And so getting information about women's health in your language builds on what you already know. So that in that sense, it's really important, rather than taking you into English, which is a whole new kind of way of understanding that thing. And there's also, it's not only a language issue, it's also culturally that we all experience our bodies and our health from a position of culture. So the way that we deliver our information is not just in a written way, it's in spoken. So we have a bilingual health educator who's able to discuss women's health issues in a cultural context. So for example, if we're delivering education about, you know, what happens in the first, say, 3-4 weeks after your baby's born, there are some kind of quite specific things that women will do in usually when they have a baby in that first 40 days. So it's really important that a woman can get information about what's healthiest for her to do in those first 40 days from someone who understands her culture and who understands those practices, rather than someone who's coming to you and you have to educate them, you know, about what is usually practiced. So it's the language, you know, being that you understand it. That's first order kind of principle. The second one is it's in your cultural context. I think the third one is about it being delivered by a migrant woman, because it's about that peer education, because you're able to have that conversation with somebody who understands where you're coming from, who understands the limitations that you might have in your life because of migration, because of settlement, because of you know, perhaps the big kind of financial impost that migration puts on your finances, so that if you are going to be taking action on your own health, you really need to be thinking about what it's going to cost you, or, you know, so I guess it's also about that being able to talk with someone who's been in your situation or understands your situation without you having to explain it.
Adele, thank you so much for joining us today. I think everyone watching can agree that the work that you're doing at the Multicultural Centre for Women's Health is completely life-changing. So we really thank you for the work that you do.
And thank you very much for having me.
To learn more, visit the MyCare channel website, where we'll have links to the Multicultural Centre for Women's Health.